Welcome to Spotlight Documentaries, our series on young leaders and coalitions of the White House Drug-Free Communities Program. Today, I'm here with Jaylena Lawes. Jaylena, you are one of the founding members of CADCA's National Youth Advisory Council in 2021 and have been instrumental in several of their projects. Thank you so much for your leadership. So, what inspired you to become a youth leader in the fight against the addiction and the drug epidemic?
Yes, I was actually within one of my local coalitions when I really felt the burden to do this work. Funny enough, it was actually a part of a CADCA project when I didn't necessarily know what CADCA was. We went out into our community and it was a part of this photo voice project to kind of capture the issues and the problems going on in our community through the language of the camera lens. And I noticed going throughout the community and kind of snapping shots here and there that there was a very uneven marketing and targeting to low income neighborhoods when it came to companies for tobacco and vaping and different substances like that. And so seeing this disparity based on targeted marketing to communities that are already vulnerable to situations which might expose them to mental distress, which is very connected to substance use. I decided it was something that mattered to me and that was important for me to do work in, just to kind of promote the health of these communities and protect them from these very unfair practices of kind of taking advantage of issues that they're already facing to create customers, which we know can be lifelong once you get a customer for these substance use companies. So that's kind of what got me into the work.
So can you tell us more about the CADCA National Youth Advisory Council and what you guys do?
Yes, so the CADCA's National Youth Advisory Council, we basically try to serve as a bridge between youth and adult voices. So trying to kind of represent the interests and the concerns of our peers when it comes to substance use prevention and mental health, putting our ear out to the community, listening, and then kind of reporting back and trying to incorporate that into the work that we do. And one of the main ways that we like to do that and kind of the main methods that we want to incorporate into everything that we do is equity as well. So making sure that all different voices are included in the advocacy that we do, making sure that they're not just included, but that they're valued and that people really feel like they're being heard when it comes to advocacy. Because at the end of the day, we're trying to serve communities. And so it's what the communities need the most that we should be listening to. And so that work for us has manifested in various different ways, various different partnerships. So for example, we hold very central or heavy roles when it comes to different conferences that CADCA holds, like their National Leadership Forum, which is always in February, and the mid-year conference, which is in July, and it's a kind of training conference. As well as we are actually in the middle of a really cool partnership right now that we're doing with HOSA. So I'm not sure if you heard of it, if it's in your part of the country, but it's the Health Occupation Students Association, I believe, or of America. And basically it's an organization that kind of invests in students who are looking to go into health and medicine. And the partnership that we did with them is that we selected 10 youth from across the country, and we kind of opened up the resources that CADCA has so that they would be able to implement their own projects in their communities related to substance use prevention. We each got a mentor. So my mentor, she's from Louisiana. She did a phenomenal job pitching and proposing her project in February at Forum. But kind of the goal of this was to, obviously, there's only so few of us on the National Youth Advisory Board, and we come with our own perspectives, but that obviously cannot necessarily cover everyone. So it was kind of to have youth who know what's going on in their local communities, they're on the ground, and kind of give them the resources that CADCA has, not just in its frameworks, the kind of information, and us as, I guess you could think of human resources, but also the massive network that CADCA has. So they were able to propose the projects in February at Forum to kind of just a very larger kind of national community that is working towards the same goal and is passionate about the same issues that they are, and kind of bounce ideas off, and kind of, use that to shape the work that they're doing in their community. So that's kind of what we do, try to connect youth to resources, try to connect youth to platforms, and really just speaking with and at times speaking on behalf of youth across the country who are in this work.
And can you share with us some personal stories where you felt like you had an impact on the students in your community regarding drug prevention or recovery?
Yeah. So in addition to being on CADCA's National Youth Advisory Council, I initially began by working with my local coalition. It's called the Broward Youth Coalition. It's in South Florida. And one of like the very pivotal moments for me in my advocacy journey was when we held this youth forum. And we kind of just, it was very like casual, very conversational, just like bringing youth together and asking them questions about like the issues that they saw in their community, what the sort of climate was around substance use in their circles and their families, with their loved ones, and asking what they felt they needed, what they felt might be helpful, because sometimes in this work you get a very like top down approach, or telling people what you think they need to hear, what they need to do, or coming up with ideas. And like, we do have a lot of information, we have a lot of frameworks that have proven to work, we have a lot of statistics about what's going on in our community, but I think it's equally important to ask the community what they need and to lend an ear. I find that we can make such more impactful change if communities feel like they're being listened to instead of talked down to. And so that's definitely shaped the nature of the work that I do, or at least the way I try to approach substance use prevention. Always kind of starting with that question of, what do you see in your community and what do you feel you need? What do you think would make the most impact for you, those people who are actually being affected, and kind of letting an ear out. So ever since that kind of forum, it's definitely changed the way that I think about and approach prevention. And I try to bring that to my work with ENYAC as well.
That's really powerful. And what steps do you think students can take to avoid falling prey to drugs?
Mm-hmm. I am definitely a proponent of kind of seeking out positive alternatives, or positive alternative outlets. A lot of times when students do decide to use, it's connected to, issues of mental health, distress that they might be experiencing. They might be looking at it as an outlet for different emotions that they're dealing with. There's also like recreational use as well, where you might be looking for a way to like have fun, or interact socially with like your peers, if that's what they're doing. And so I think having those positive alternatives for youth to come together and do things that don't involve them using substances is really important, as well as having those resources out, so that if you are feeling a certain way where you feel like you might need to cope through substances, that you have somebody you can talk to, like maybe a professional or a trusted adult, and kind of just creating a culture where it's not necessary to use substances in order to have fun, or to, think through or grapple with your emotions. I think is super important. So down here in South Florida, we have like a lot of events where students can come and do self-care workshops, meditation workshops, expressive things that could help them maybe get some things off their chest, like poetry jams. We've held support groups and different things like that. And I think that's definitely helped youth know that they have somewhere to turn to that is not necessarily a substance.
Yeah. And what are some top strategies when you talk to someone, your peers, who you might suspect have an issue with drugs?
I think that, for one, before you have a conversation at all, I think it's important to gauge your relationship with the person that you might be suspect might be having an issue with drugs. Um, because depending on that, that might set the level of comfort for what that conversation is. Like someone might not want like someone who's a stranger to them or they don't know so well to try to make like assumptions about what they might be doing or to kind of, tell them what they should or should not be doing. And so I think having that relationship can create the grounding where they can be sure that the conversation that you're going to have with them is coming out of a place of care, that you have within that existing relationship. So I'd always say to gauge it. And kind of if you know someone, or you notice someone might be struggling with drugs, you can also, if you don't feel like you're in the relationship with them to bring it up, you can also talk to somebody who might be closer to them or who they might be more comfortable with, to kind of get that going, because that always kind of eases the atmosphere around what could be a very difficult and uncomfortable conversation. But if you are that person, I think an important first step would be to start with a question. I'm very intentional about not making assumptions or not necessarily coming from a judgmental stance almost. So I might not say, like, what's wrong with you? Like, I see this going on. I might say, like, well, I think you might have been acting like a little different lately. I think I noticed this here or there. Is something going on? Are you okay? If you actually like witness like the act of using, you can be like, I saw you doing this the other day. Is there a reason you feel like you need to do that now if you haven't before? And kind of like asking those questions to kind of ease the conversation in. And then another important question I would say, and that is kind of the question of why. Sometimes we assume why people might use drugs, but I think it's important to ask why, both for you, like the individual asking, so they can like try to point their loved one towards the best help that they can have, but also for that loved one who might be struggling. Because why is a question that kind of sparks a lot of reflection for them. Well, yeah, like, oh, why am I using this substance? Why do I feel the need to? And I think that can kind of like get to the root of the problem as much as you can in like a conversation or two. And that like that's a question that I found has been very effective as well. And then another strategy I would say is to um, establish your support for them, but to also know your limits and how much or what kind of support you can offer. So in the sense that you're like, I'm there for you and I care for you. But at the same time, there are certain instances or situations in which you need to call in like a trained or licensed professional, because there are just some help that you cannot provide. Even when I was in high school and I had been doing trainings for years, there were still certain places where it was not my place to step in, and you should also know when to call somebody else in.
Right.
Yeah.
That's great advice. And there's a lot of talk about social media's role in accessing harmful substances. So what's your advice for social media users?
Yeah, I think that social media is a very interesting place in the sense that it creates this feeling of being like of hyperconnectivity in the sense that like you can engage with someone from like anywhere in the world and find something in common that you can like, you know, perhaps bond over. But I also think it's important to distinguish between that kind of like community that exists on social media and actually knowing somebody. Like social media is a platform that is very curated. People parcel together pieces of their lives and put it out there. So I think it's important to know that unless you have that like established relationship, that you can truly not know someone on social media. And going off of that, I would say that in general, in terms of access, you should not be taking things or taking substances from at all, but from especially from people that you do not know. And I'm sure, as you know, with the fentanyl crisis, for example, people will be offered drugs from people they may know a little bit or who they know, but they don't know exactly what's in there. And I think that's a lot of the danger, is that you don't know the people on that platform truly, and you don't know what they are giving you. You may think it's one thing and it could be completely different. So I would be cautious to know that it's not really a trustworthy place to begin with. So you definitely don't want to be accessing substances through social media. And I think our generation knows when something is shady as well. So I think it's important to look out for that, as well as I think in addition to access, social media is also a place that not only like you can purchase substances, but also that just in general glorifies substances and people, maybe on their accounts and promoting a drug and like it's the best thing in the world. And I think going back to this idea that social media is a curated place, just because someone in like a snapshot or a video makes it look like the best thing in the world, you're not seeing the harm that it could be doing, that they may or may not be aware of themselves, to their bodies, to their social and emotional relationships with other people, mentally within themselves. There's so much that you don't see. So especially with social media, I think because of that non-seeing factor, there's a sense of ease with substances, but I would watch out for that sense of ease because it's actually a source of true danger. So that's like something I would say about social media. Yeah.
And I think it's really important that you brought up the fentanyl crisis there. So,
Mm.
are we doing anything differently currently to help fight the fentanyl crisis?
Mm. Um, yeah, so with the fentanyl crisis, there are many different levels of fighting that are going on. Um, so I'm sure you may have heard from like any of your other interviews, but there are like national agendas towards the fentanyl crisis to stop fentanyl from entering the United States at all. And that's not necessarily something that like you would do on the community level or with like among your peers or in your local coalition. Um, but there is that agenda going on to kind of stop it from entering in the first place. But in terms of what is actually here already, and what you can do kind of on the ground, what we've been focusing on is really spreading awareness to people about the dangers of fentanyl and then the ways that it would show up in their community. So some people, in terms of the dangers of fentanyl, creating awareness around that, we want to know that if it's said, if you hear about it, you know the dire impacts that it can have, in terms of like that kind of knee-jerk reaction, that it's not something like that you brush off. Oh, it's not that bad, it's not that dangerous, it's not that harmful, so that they know like the true dangers of what's going on. But also, I think it's important to know what to look for. Um, Fentanyl often camouflages in what people think are different, like or other drugs. Essentially, they'll think it's one pill or like they'll think it's one substance, and it will actually turn out to be laced with or just entirely fentanyl. And that's how you have young people who are taking what they think to be something that would be quote unquote safer and then overdosing on that drug or dying from that drug because they did not know what it truly was or they did not know what was in it. So I definitely think knowing what it looks like is crucial in terms of fostering that protection for youth, because it's often very hard to detect if you don't have the eye out for it. So those are two strategies that we've been doing to know as a concept, like how dangerous fentanyl is, but also to know like physically, like what you can see, to know what it looks like and how it shows up.
And do you think we can end the crisis?
I do. I think that sometimes when you're dealing with something like fentanyl, which has just been so fatal and so deadly, it can be easy to kind of get caught up in like the statistics of harm and like these very sad stories that truly do emerge from this crisis. But I think equally important as it is to raise awareness about the harm that it's doing, it's also important to foster hope, not just for people who are advocating to fight this, to know that there is a reason to go on, to know that this is not necessarily the end or it's not unbeatable, but also for people who are affected, people who um, have been affected by the drug, people who have lost people from that drug, to know that it is also like there is more, that it's not, um, like I said, unbeatable, and that there's something being done to ensure that we lose less and less people until it's completely over. Um, just to know that like there's something to hold on to, because it can be very devastating, because it is a very devastating crisis that is going on. I think hope and knowing that it will end um, is just as important. Yeah.
It's very inspiring. And how can we spotlight and celebrate students that choose to stay clean and encourage them to become leaders?
I think it's kind of just what you said, like become leaders, inspire them to become leaders. I think that having the opportunity to step up and use your voice on a platform, kind of like the platform that CADCA has given to the National Youth Advisory Council, but even on local levels, like with different coalitions and things like that, giving youth the opportunity to speak up is super important. I think sometimes youth may veer to substances because they don't feel heard, or they don't feel like they can be heard. And I think, especially when youth who decide not to use substances, an important way that you can kind of like acknowledge that and kind of applaud that is to give them the opportunity to lead, give them the opportunity to speak to their peers, to speak on behalf of their peers, um, acknowledge and value their experiences and the very vast knowledge that they have to bring to the table. I think that is so important. I think, you know, it's made a difference for me. It's made a difference for my peers that I've talked to on the National Youth Advisory Council, that I've talked to from my local coalition. Having that opportunity and that platform to voice these concerns and these issues is extremely rewarding. And I think that's just one way that you can do that. Yeah.
How can more students be part of CADCA? Is there a selection process?
Yes. So there's various different levels that you can be involved with CADCA through. So every year, CADCA holds two main conferences. So there is the National Leadership Forum in February that's held in DC, and there is the Mid-Year Training Conference that is held in July at various locations. And so you can like attend those with an adult supervisor and yourself, or maybe with your coalition. Um, that's actually how most of the people who are on the National Youth Advisory Council right now kind of got into it. I remember for me, I went to a mid-year conference. I believe it was 2021. Yeah, it was 2021, I believe. And um, we were attending virtually because it was during the pandemic, but me and a few people who are on the National Youth Advisory Council right now, we attended the mid-year training conference, and we did this training track called Applied Health Equity. And at the end of the track, we gave a presentation to the president of CADCA, General Barry Price, and a representative from the CDC. And it was kind of like through those 4-day conferences, because it's about 4 to 5 days, those 4-day conversations that we had in those tracks, going on to share what we had learned through those conversations, what we had learned through reflection of what we saw in our own communities, and giving that presentation. That then, I think the September after that, July, people from CADCA that we had worked with on the track reached out to us and told us that they're starting this wonderful new part of CADCA called the National Youth Advisory Council, and they invited us to apply, and that's sort of like how we've gotten here. And so that is just to say that attending those conferences that they have can be like so like pivotal in terms of like the connections that you make, the people that you meet in terms of working with CADCA. So that's just one way to get involved. But then yes, there is the official application processes. So you can work with the National Youth Advisory Council. The term for our cohort will be ending this year. So that means applications will be opening up as well, to kind of get involved with the National Youth Advisory Council and serve in that particular role. And then as well, CADCA has a youth trainers program. So that you apply for every 2 years. The last application cycle was in 2022. So the next one will be in 2024, I believe. And that is basically you become trained to train others at these conferences. So all the different workshops that you would go to at these conferences, you can, through a series of training that happens throughout the year after you applied, kind of learn how to do that and then pay forward what has already been invested in you. So those are just like a couple ways that you can become involved in CADCA, application or no application.
And what are your future plans in terms of college career and your work in drug prevention?
Yeah, so I'm actually in college right now. I'm having like a great time. I study the history of science and medicine, and it's been very interesting in public health. It's been very interesting. It's given me a lot of insight into um, kind of like the histories that affect the issues that we're dealing right now presently, which I think is very important, even with when it comes to substance prevention. A large part of the work I do in trying to promote equity in that is acknowledging what have been very painful histories at times of drug prevention and intervention, especially like affecting Black and Brown communities in the United States, and what the legacies of those might be when you're going into communities and trying to have these very real conversations and implement these really helpful programs about how you can stop people from using substances, that there are histories that have to be addressed first before the conversation can even begin. And so I think that in that sense, for me, like studying the history of that has been um, very like it's provided a lot of insight to the work that I do in terms of advocacy and organizing in the community. But apart from college, I think after that, I'd like to attend grad school, pursue a grad degree, kind of in the same field that I'm studying right now, and produce research, as well as continue to work like in this advocacy role, kind of similar to the way in which I work for CADCA, to kind of bridge that gap between, I guess, like the academia and the actual on the ground work that's being done. And yeah, I mean, that's basically the plan right now, but it's only my first year, so who knows? Yeah.
Thank you so much, Jaylena, for this
Mhm.
interview. And
Thank
thank you
you.
for your work and being an inspiration to others as well.
Thank you. This is a wonderful project you have going on.